we'll start with a new topic, that is genetics and health. So there are many possible causes of human disease. The first example is family. So it is a strongest risk for some of the disease such as cancer, cardiovascular disease, diabetes, certain autoimmune disease, and psychiatric illnesses. So family history is thought to be a good predictor of an individual disease because family members most closely represent the unique genomic and environmental interaction that an individual experiences. The family members and the patient is in same environment, so they may have the same interaction with the environment and the genomic representation. Okay. So, inherited genetic variation within families clearly contributes both directly and indirectly to the pathogenesis of disease. So, the person who is inherited genetic variation from the parents or ancestors will have some of the pathogenic diseases. So, that's why a community health nurse must have the knowledge of genetic factors affecting health condition and the eugenics. So, what is eugenics? Eugenics is the word which is coined by Francis Galton in 1883. It's a Greek word. Eu means good or well, and genes means born. So, it's the study of improving the genetic qualities. So, what is the definition? Eugenic means it's mainly concerned with the decrease of hereditary disease and improvement of the overall health status of the people or community. So, it deals with the decrease of hereditary diseases, which is hereditary from the ancestors, and how you can improve the overall health status of a people or a community. This is what the eugenic means. One more definition given by Francis Galton in 1940, that is, eugenic is the science which deals with all influences that improve inborn qualities of a race, also with that develop them to utmost advantages. Here, the Francis Galton told the eugenic means it's the improving of inborn qualities of a human race. So, what is the goal? Goal of eugenic is to improve the genetic composition of a population. Genetically, it should be good composition in the population. So, what is the aim? It is to save the resources, the whatever resource present, to create a healthy community, to have intelligent people, or to have the community to free from mentally retarded people. Nobody likes mentally retarded people, and even it is a burden to the nation. So it is to reduce economic burden on nation due to disease and to decrease the human suffering. So these are the aims. So now, how eugenic measures reduce the health problem? Which and all measures we can use to reduce the eugenic health problem? Okay, so there are two types, that is positive eugenics and negative eugenics. Positive eugenics means it's a production of the good individual or a genetically advantaged population, that is by in vitro fertilization. In short form, it is IVF. You have seen, I guess, in vitro fertilization, cloning, and it is difficult to achieve because of the complexity of the trait, multifactorial causes, and unawareness regarding which gene to be transferred or which not to be transferred. This is some of the problem they will face in the positive eugenics. And negative eugenic means it is to decrease or lower the fertility among genetic advantages. Okay, so there are many methods like abortion, sterilization. Sterilization means the permanent method of birth control, adoption of family planning methods. Family planning method means there are two types, that is permanent and the temporary methods. Though the parents or a couple can adopt these methods. So there are the various ways to achieve healthy community by eugenics. Okay, there are many methods to achieve the healthy community. So like eugenics, genetic counseling, marriage restriction, birth control, early diagnosis and treatment, and segregation of family ill from normal. These are the certain ways. So what is eugenics? Eugenics is manipulating the environment in order to improve the genotype. We are manipulating the environment which is present around the person or inside the person, so that we can change the genotype of a person. Which and all, how you can change, like if the person is smoking, we can stop them. Then changes of diet, obesity, lack of exercise, in reducing the disease such as cancer, hypertension, diabetes mellitus, which can cause abnormalities in genetic constitution. So by changing the diet, or by decreasing the obesity, or by increasing the exercise, we can reduce. These are the conditions. As man is adopting the environment, it leads to increased chances of having healthy population. If the person increase using of healthy diet, and if he is doing certain exercises, then we can improve his internal environment, okay, or his biochemistry or physical environment. So what is genetic counseling? Second one is genetic counseling. It includes screening of the cases and informing them the risk of having the affected children. So in the genetic counseling, we can screen the parents or the couples, and then we can explain them how they will get the affected children. So this will help them to take decision and prevention of further occurrences of genetic diseases. We can decrease the genetic diseases. Okay. In the marriage restriction, there are third way, that is marriage restriction. Here, marriage is restricted among the people who can produce affected children. Like if the person is mentally retarded, we will not allow him to marry the normal one or another mentally retarded one, because they may produce the same affected gene or same affected children in the future. Like, see that example, like the following cases marriage need to be restricted, like marriages among the individuals suffering congenital abnormalities, mental retardation, gout, thalassemia, sickle cell anemia may increase the risk of the defective children. If the person or an individual is having the congenital abnormalities, or if the person is having mental retardation, gout or thalassemia, they may have some affected genes, so we will not allow them to marry. Next one is consanguineous marriages to be avoided. Consanguineous marriage means marrying within relation. Okay, if the person is marrying the nearby relation, okay, like your mother's daughter, mother's son, mother's brother or a sister, like that, or a father's brother and sister, like that. If they are marrying, it is a consanguineous marriage, so they may have the affected genes. Next, late marriages increase the risk of genetic disease such as Down's syndrome. Down syndrome, you have heard, I guess, moon face, and there will be mental retardation, short stature. That is Down syndrome. So, if the person marrying late, then he may get the children with the Down syndrome. Next method is birth control. It is to reduce the frequency of hereditary disease and disabilities in the community to the low level due to adoption of birth control measures. So, we can reduce the disabled children in the community by adopting these birth control measures. There are two types, that is temporary and permanent. And next one is early diagnosis and treatment. Some of the genetic disease which was diagnosed earlier can be corrected, such as congenital hip dysplasia. Hip dysplasia is a condition it can be treated just by early diagnosis. We can diagnose it early and we can treat it. It can be made by identifying the carriers of genetic disorder by investigation, such as serum creatine kinase level to identify the carriers of muscular dystrophy. If the person is having any genes of muscular dystrophy, then it can be identified by serum creatine kinase level in the blood or a body. So last method is segregation of mentally ill from normal. There is need to be segregate mentally ill from normal so as to prevent birth of mentally ill child in community. For example, a mentally ill person who is living in community gets married to either a mentally ill or a normal genetically healthy person. In such case, the offspring will have abnormal genes, and if this continued, it will lead to more hereditary disease in the community. As I told in the marriage restriction, we should restrict the marriage between the mentally ill person or a mentally ill patient with a normal or another mentally ill person. So we can avoid the increased mentally ill patient in the or a mentally retarded patient in the community. So how we can apply this methods of this eugenics in the society? There are three levels. First one is at government level. In the government level, we can apply this by forming some certain policies and legislation. And in the population level, we can give a education regarding that. And in the individual level, we should adopt those practices and to reduce the economic burden of disease in the family. By adopting these measures, we can reduce the economic burden of the family. So lastly, what are the roles of community health nurse? Nurses' knowledge on genetic diseases to be needed, because if she want to treat the genetic ill patient or a mentally retarded patient or anything, so she need this genetic information, knowledge on the genetic disease. Next, she provide education to people about risk factors for hereditary disease such as diabetes mellitus, hypertension, which occur due to multifactorial reasons. So she must need a certain knowledge regarding this diabetes mellitus, hypertension, so she can give a information to others. She must identify the hereditary disease among the population, refer and motivate them to seek medical treatment. She should identify the hereditary disease among this community, then she can refer it to the hospital. Next, she should inform the community about genetic testing, and she analyzes the data and develops plan to address the genetic concerns. Okay, she will analyze the data, how many patients and whether they are treated, whether it cannot be treated, like that. Some analysis she will make, and she will update the data and develops plan to address the genetic concerns. And the plan to manage the hereditary disease to control and reduce the chances of genetic disease and will prevent further occurrence of abnormality in family. She will give the information to the family about the hereditary disease, genetic disease, and by this she can decrease the abnormality in the family. She teaches the people about eugenics methods such as birth control and genetic counseling. And lastly, she identifies the carriers and deceased person in the community and refers them to the hospital. So that's all about the genetic and health and the eugenics. We'll see in the next chapter. But thank you.